I think the very important thing that about what we know of this so-called epidemic of obesity, in fact, is a global epidemic, but it varies by different stages. Of course, the epidemic has started about 50 years or more in the West, such as the UK and in the US. But in low and middle income countries, including China, it had just started about 10, 20 years ago. So when we try to look at what obesity has done in affecting health, then obviously the stages of the epidemic are very different. So when we come to look at ethnic differences, for example, whether there are any differences between Caucasian and Asian or Chinese, then we must bear in mind of these stages of epidemic very carefully. Different regional presentation of the harm due to obesity can be due to the different stages of the epidemic rather than due to ethnic differences, because there will be a gap of 30, 40 years before you see the peak of obesity and also the peak of mortality attributable to obesity. So that's why at the moment, even in the West, we are seeing the early stage, and I will describe it as sort of stage 2 out of 4 stages when you compare with the stages of epidemic of tobacco. In tobacco, in Western countries like in the UK and in the US, they are now at stage 4, meaning that they have already passed the peak of tobacco consumption, whereas consumption has already declined. They have also passed the peak of mortality, whereas mortality due to tobacco has declined. But in Western countries like the US and UK, the epidemic is still growing. So we have not yet seen the peak of mortality. We have to wait for another 10, 20 years before we see that. So we see no signs of decreasing mortality or decreasing epidemic of obesity itself. So we have to be very careful, even looking at Western and highly developed countries. But when you look at China and Asia, they are even at an earlier stage, meaning, for example, stage 1. Their obesity level is just at the beginning. So the problem due to obesity is not yet realized. So if you are not careful, then you will say that, okay, it is not very serious. In fact, what is worse is yet to come. First in the West, and will be followed by a few decades later in the East, if we are not doing something to control it right now. But the lesson from the tobacco epidemic tells us that if you can control it early, then you can you can control the peak of the epidemic of obesity so that it won't go further up. But then the obesity-related mortality will still go up for some years before it will go down. So the greatest opportunities actually now rest in the West, in showing the way how you can control it. At the same time, there must not be complacency in the East, for example, like China, saying that, well, we don't have a serious problem yet. The problem will become very serious.